interactive. Alright, so you guys get to talk to me, so you don't talk to you. So what kind of things might you as CSRs or in pet care see or hear, see yourself or hear from an owner that might be related to the ears? Scratching their ears. Yes. Funky, gross, disgusting smell. Shaking the head. Yep. Discharge. Okay, good. Redness. Good.
Madison said rubbing your ears on the floor.
Rubbing ears on the floor. Okay, good. Anything else? Those symptoms all might indicate one or two different things. What would those two things be? The rubbing, the itching, the redness, the discharge, the heat. Those things generally are going to be either something over here or something over here. What are those two things? You guys know?
Allergies?
Yeah, so you guys know what you're talking about. Ear infection or allergies. So when you get a red hot ear that's itchy, it's going to be either an ear infection or allergies. We don't know which one, and that's why we need to see them, right? Because when people are like, well, can't you just give me some medicine? Well, if we give medicine and it's just related to allergies, that's not going to do anything, right? So with ear infections, does anybody know what type of ear infections we see in dogs and cats? Ear mites? Bacterial infections. Yeast. Bacteria breaks down into kind of two different kinds, usually categories, if you will. Anybody know what those are?
Is it aerobic and anaerobic?
Good guess. So there are aerobic and anaerobic bacteria, and sometimes we have to check for that with a culture. But we just differentiate them usually based on their shape, the shape of the bacteria. Anybody know what shapes? Rods and cocci, yeah. And then in those categories of rods and cocci, then you might further break it down with a culture to like an aerobic or anaerobic bacteria. So ear infections are usually going to be a bacterial infection, yeast, or ear mites. And then allergies, what might cause the ears to be itchy that's related to allergies? What kind of allergies? Seasonal, that's one option. Or food. Yeah, so with allergies, with dogs and cats, you know how with people that have allergies, what are your symptoms? Like if you're allergic to pollen, what are your symptoms? Sneezing, runny nose, watery eyes. With dogs that are allergic to something like pollen or an environmental allergy, what are their symptoms? Licking, chewing what? Their feet, that's right. Licking and chewing their feet or their belly. So anything from kind of like their leg down, they really focus a lot of that when they have allergies. And there's one other area of their body that they focus on when they have allergies, which is, we're talking about it right now, the ears and the face and the eyes. So around their mouth, around their eyes, and their ears. So unlike with a person who, if you're allergic to something in your environment, you're going to start sneezing, get watery eyes, maybe get a scratchy throat. Dogs are going to get itchy feet, itchy bellies, itchy faces, itchy ears, and itchy butt. The butt is also part of that whole complex. And so sometimes people don't understand that, and so, you know, they think, well, how could it be allergies? They're not sneezing, you know? But that's the allergy organ for dogs, is their face, their butt, and their underbelly. If you, as a person, had a food allergy, what would your symptoms be? Swelling, maybe in your throat, a rash. Yep, maybe what else?
Coughing.
Digestive issues. You might get the bathroom, have to hit it up frequently, vomiting, diarrhea. With dogs, what are dog symptoms of food allergies? Again, it's the same thing that we talked about. Underbelly, feet, butt, face, ears. And so you can see how to like a pet owner, it's counterintuitive. You know, they don't understand that those things can like equal each other because they compare what they know of allergies to what their symptoms are, which are completely different than a dog or a cat. So that's something I think is really important to keep in mind and to sometimes remember to, kind of tell people, well, unlike with people, dogs, their areas where they're usually affected by allergies is going to be these areas. Okay, what else might you see on the ear? Or might an owner tell you besides infection or allergy related type symptoms that they might see or describe? Head tilt, okay. What
I
else?
had a guy call saying that his dog's ear was swollen.
Swelling
like
of the ear,
like a
the ear
ravioli.
flap. Yep, that's good. What else? Okay, matted hair. What else?
Scabby.
What? Flea dirt? Maybe. Yeah, maybe. What'd you say?
Flaky, scabby, yeah, like on the edges.
What about growths? Tumors. Those happen in the ear a lot, right? If they are in there, they bleed like crazy. Bleeding of the ear is another, not super common, but you might get a complaint that the ear is bleeding. Maybe it's a growth that's bleeding. Maybe they got into a fight with another dog and they got a little puncture wound. But the point I make with that is that when the ear stops bleeding or starts bleeding, is it going to stop very quickly? No, it's going to bleed forever. They're going to think the dog is going to bleed to death. And it's going to look like if they shake their head, there's going to be blood everywhere. And they're going to come home and there's just going to be blood everywhere. And they're going to freak out, right? Like that is where it becomes something probably pretty minor for the pet, becomes like way up here emergency for the owner. Because there's blood everywhere, right? What else? Anything else? What could swelling of the ear be? Could be the ear flap. You don't know. They could get stung by something. Yeah, so it could be like a local edema from a skin bite, which would be allergic. Or it could be, what else did anybody say it? What else can make what can make the ear flap swell up?
I know when I was grooming like a dog that came in really, really matted, once I shaved it, it started bleeding like out of the pores.
Okay. Bleeding into the space in between the two pieces of the ear, right?
No,
Yeah.
like the flap, like
Of the
swelled
flap.
up and then it
Yeah.
started bleeding.
And that is called, anybody know what that's called? Where blood fills up in between the two pieces of cartilage of the ear? Anybody know what that's called? Ear hematoma. Yeah. What is a hematoma? Does anybody know what a hematoma is? Like the word? If you said, I have a hematoma on my leg, what do you have on your leg? A bruise, right. I mean, so if you say hematoma to a person who knows what a hematoma is for themselves, they're going to think a bruise. And it's not a bruise, right? It's just what we call it because that's what the name of it is in vet medicine. But again, we have to kind of think about how words that we use don't make sense to people who are not in the field. That's part of my point of this, is that we have to really think about these words that we're using, what they mean when we use them, not in the vet field, and what they're going to mean to somebody if we just start throwing out these words to them. So ear hematoma is where the ear swells up with blood, and that can happen from tight mats, because if you're pulling on that, it can burst the little capillaries in the ear. You've probably seen this happen before, guys. And the ear will start bleeding within itself, like what Diana was saying. What else can cause ear hematomas? Just shaking their head. Yeah, when they shake their head, it bursts the little capillaries in the ear, and it can cause the ear to swell up. What else can cause it? Trauma. Yeah, injury, a bite. That's a common thing. Or maybe they were, roughhousing with the other dog and there's no wound, but maybe the dog bit them and it burst those little capillaries, and now the ear is swollen. So what is a very useful tool for us? And this could be from you guys in grooming, it could be in pet care, it could be CSRs. What's going to be something that's very useful for us to kind of help figure out? Because do we normally think of ears as an emergency? No, usually. But there are times that it could be an emergency. It's never going to be emergency as far as like life or death. But when are times that it could be something where we would need to almost treat it like it needs to get in today, we need to make this happen? What situations of those things that we just talked about might be situations where we would want to kind of make sure we get that pet? Well, uncontrolled bleeding. Yeah, any kind of uncontrolled bleeding needs to be addressed, right? Doesn't matter if it's from the ear or someplace else on the body. So uncontrolled bleeding. What else might be a perceived emergency? You guys get these maybe as CSRs more than pet care, but
trauma, injury.
Maybe, but if it's not, so what about trauma or injury would make it something where it would have to come in right away?
Well, I mean like perceived emergency to the, if they get bit by another dog or something.
Right, but like, what about that trauma would make the owner perceive it to be an emergency? If their dog's acting fine, are they going to perceive it to be an emergency? No. So what about it is going to make them perceive to be an emergency?
If the dog will stop shaking their head or if it's staggering around.
Extreme discomfort or pain, right? So sometimes they may tell you and describe to you on the phone what sounds like an ear infection or what sounds like allergies, and the owner is just hysterically crying. They're a mess. And you're thinking to yourself maybe, why are they such a mess? What is going on? This sounds like an ear infection. But that pet may be terribly uncomfortable, just not able to even sit still or sleep or eat because their ear is so uncomfortable. So we have to kind of recognize, I guess, that sometimes these things can be more urgent. What is a tool that we can use to really help with that shows that we're caring and empathetic to these cases, that everybody keeps in their pocket all the time, most of the time? What? A phone. So whether you're in the spa and you're doing something, or if you're pet care and you notice something, or you're on the phone with clients and they're describing something, getting people to utilize that device that's in their pocket to take a video or a picture is extremely helpful. Because as you guys as CSRs know, we often don't have an opening for something like an ear infection same day. And so it's really helpful to be able to say to somebody who is wanting to come in, maybe they perceive it to be an emergency, can you take a little video, and you can even pull up LADDM and look at it while you're talking to them. Or can you take a picture of what you're seeing, or if it's on the weekend, guys, and you're noticing something with one of the pet care dogs, just posting a picture or a video of what they're doing is very helpful. Now, when we ask for pictures, how do we want to tell the owner, or how do we want to take the picture?
I just tell them to take a couple different angles, like one closer up, one further away, so you can kind of see the whole pet and the head.
That's a good idea. Yeah, because oftentimes we'll get a picture and it will be so close up, you can't even, it's like that game where they magnify something and you have to identify it and figure out what the heck it is. You're like looking at it, you're like, is this even the ear? Like, what is this? So close up and far away, not too close. It's very helpful. All right, treatment and diagnostics. So what kind of diagnostics do we do to diagnose ear infection? Ear cytology. What is that for anybody who may not know what an ear cytology is? What are we doing with that? Yeah, we look at it under the microscope. Swab the ear, get a sample. So use a little cotton tipped applicator, Q-tip, to get a sample out of the ear, and we look at it under the microscope. And that's called an ear cytology. And what are we looking for? We talked about it already? Rods and cocci. Yeah, with ear mites, it's a little different. We still got to get a sample from the ear, but we don't, and we still look at it under the microscope, but the way it's prepared is a little different because ear mites are really big and they crawl around all over the place. You put them on a slide and they'll just crawl right away. So they have to be mixed with oil, and that is to keep them put because they can't crawl very good inside that oil. Otherwise, they'll just crawl right off your microscope slide, which is gross.
Yeah.
I just feel like pictures running everywhere.
Crawl away. And so let's say we've got a bacterial infection, that's going to need to be treated. The owners are going to need to probably have some ear clean solution, or the ear's going to have to get cleaned out. And then we got various different ways we can treat it. Either the leave-in products, which we call ODIPAC, lasts for 2 weeks, is one and done. When we put it in there, because it's a really thick solution, it's like a paste, we have to warm it up, make it into more like liquid where it comes out of that syringe, because if you try to push on it when it's cold, it's not coming out very easily. And then as it gets into the ear, it starts to cool off again and it solidifies. Now that doesn't have to get taken out. People always ask, do you have to take that out of the ear? It just kind of slowly disintegrates, and as it's in there disintegrating, it is releasing antibiotic, steroid, whatever is in that ODIPAC. There's different formulations or recipes sort of for it, and they contain different ingredients. So whatever's in that ODIPAC is just going to be dissolving over that period of time. Now, one thing that we'll see sometimes after we treat ears, whether it's with an ODIPAC or with another medication, is what?
Ear loss.
Hearing loss, yes. So there are some medicines that if the eardrum is ruptured, they are toxic to the hearing. They are called ototoxic. And so that means that if the medicine goes in, it can actually cause the dog to become deaf. Sometimes it's just the ODIPAC that's in there because it's really thick stuff. It'd be like you getting a bunch of, Vaseline shoved into your ear and you can't hear very well, because you got all this junk in your ear. So if somebody calls or they report hearing loss, definitely tell them that you're going to let the doctor know. But, assure them that sometimes it is temporary, especially if we got ODIPAC. It will usually get better. Ear mites, we treat with different medications. What else treats ear mites besides the medicines that we put in the ears? What?
Some topical medications do, like Revolution.
Okay, so Revolution treats ear mites. That's right. And that is something we use for heartworm and flea prevention. What else treats ear mites that we might use for heartworm and flea prevention? Trio, yep. And NexGard and what? What's all what? There's so many. What? No, not everyone. Not that one. Not Crowheart. So you said Trio. What's Trio's friends?
Simparica.
Simparica. You said NexGard. What is similar in the same category of those drugs that we don't carry here, but it lasts for 3 months? Bravecto. Yep, so mites are like little, they're not like ticks, they're not ticks, but if you think about things that are going to treat ticks that are oral, the oral things that treat ticks, they're generally going to also treat mites, ear mites and skin mites as well. So that's interesting. With a allergy, how are we going to diagnose an allergy? What are we going to do? Of the ear. We're talking about ears too. Yeah. So how are we going to diagnose allergy-related ear problems? What do we got to do first? Anybody?
Rule out the bacterial.
Do a ear cytology. Do an ear mite check. Rule out that they have an infection. We got to make sure, because sometimes they have both. But we got to make sure they don't have an infection. So very good. Once we've determined that they don't have an infection, then what would our treatment be? Some sort of allergy medicine, right? Yep. So Cytopoint or Apoquel, severe cases, we might go old school and use steroids, prednisone. And then maybe something even in the ear itself, you know, there are products that we don't really have here, but that are just like cortisone. They just have anti-inflammatory for the ear. And then ultimately we got to get to an underlying cause, which is going to be either allergy testing for food or environmental allergy testing. Ear hematomas, what is the treatment for that, or diagnosis of that? How do you diagnose and treat that? That's, what is ear hematoma?
Usually you can see it.
It looks like a little pillow, looks like a little swelling on the ear. So, an exam. That's the diagnosis, right? We gotta do an exam. Treatments, sometimes we can treat them with steroids and that blood will reabsorb and just kind of go away. Sometimes we can do surgery to drain it and make it where it doesn't fill back up. Draining the ear, just poking it with a needle or lancing it, is not going to work because it's still going to be bleeding. It's just going to fill right back up. What was I going to say about that? Sometimes people will choose to do nothing. If they do nothing, is that wrong? Does that make them bad people? No. I mean, as long as the dog's not painful, it's no big deal, right? What happens if they do nothing?
The ear crinkles up.
Yes. So the ear, has anybody seen a person that is a wrestler? What? They get a cauliflower ear. So, and you guys have seen this in dogs, and you may not have known, but their ear will shrivel up and it'll get all wrinkly and stiff and hard, and that is because they've had ear hematomas. And it's permanent when that happens. And sometimes they can treat them appropriately, and that will happen, but it will always happen if they don't treat them. Bleeding, how do we diagnose that?
You can see
Is it time? I don't have a watch on. Sorry. Oh, we gotta stop then. Oh, we're done here.
Thanks, Dr. Beatty.
Bye.
Thank you.